One of the most common questions I get in clinic is, do statins cause dementia? So let's separate between what's real, what's misunderstood, and what the data actually shows, because that's not the same thing. Some people do experience brain fog, fatigue, or muscle pains while they're on statins. That experience is real, and dismissing it does not help anyone. But how do statins work? Statins work by blocking the mevalonate pathway, and that pathway doesn't just make cholesterol. It also produces compounds involved in mitochondrial energy production, including CoQ10. And in certain people, this can reduce energy availability in muscle cells, leading to or contributing to fatigue, muscle pain, or brain fog sensation. And that effect is dose dependent, and it varies person to person. And it's important to remember that it's most prominent in skeletal muscle, not the brain. And that explains the side effects. It doesn't mean neurodegeneration, and it doesn't mean dementia. This is where the online conversation goes wrong. Brain fog is not dementia. Feeling mentally slower is not the same thing as developing Alzheimer's disease. Temporary symptoms and long-term neurodegenerative disease are completely different endpoints. When researchers look at long-term outcomes, including dementia and cognitive decline, randomized trials and large population studies do not show an increased risk from statins. Many large observational studies show no effect or even lower risk among statin users. Now, that doesn't mean statins prevent dementia, but it strongly argues against the idea that they cause it. And this isn't based on one or maybe two studies. We're talking multiple meta-analyses, pooling data across dozens of studies, randomized trials involving tens of thousands of patients, observational cohorts with follow-up extending beyond a decade, which is 10 years, and across different populations, different statins, and different study designs. The findings are remarkably consistent, and that level of consistency is important and should not be forgotten or ignored. Now, the FDA has acknowledged rare reports of memory symptoms with statins, and they specifically describe those as non-serious and reversible. Now, that's very different from permanent brain damage. And I'll tell you, in real clinical practice, if someone develops cognitive or muscle symptoms, we adjust the dose, switch statins, or stop the medication. This is not a situation where you try to push through at all costs. But for the patients who are at high cardiovascular risk, avoiding statins entirely does increase your risk of developing a heart attack or a stroke. And strokes definitely affect the brain. Medicine isn't static. If high quality evidence comes out that meaningfully contradicts what the current data shows and what I've discussed in this video today so far, I'll make a new video explaining it. And the same is true if another therapy is shown to reduce cardiovascular risk as effectively or more effectively than statins, with the same depth and duration of evidence behind it. But based on the data that we have right now, randomized trials, large population studies, and multiple meta-analyses involving millions of people, the evidence is consistent. Statins do not increase the risk of dementia. That does not mean side effects aren't real. What it does mean, though, is that the long-term cognitive effects that people worry about is not supported by the data that we have so far. But keep this in mind, lifestyle changes matter. Nutrition, exercise, sleep, those are foundational. And statins are not meant as a replacement for lifestyle changes. They're a tool. And just like any other tool, they're used selectively, not blindly. So if you're worried about statins and your brain health, the current evidence is reassuring. And the real conversation isn't statins versus lifestyle. The real conversation is, what can you do to reduce your cardiovascular risk intelligently? And as always, talk to your healthcare provider, ask all of the questions that's reasonably possible in the time constraints that you have. And if this video helped you and you want something a bit more structured, I've created an introductory weight loss ebook that walks through some of the main principles associated with weight loss, talking about different diets, etc., without anything extreme. It's on my website, where I also post blogs on health content. Link in the description below. If you've watched this video and you're still thinking, but I want to lower my cholesterol naturally, I have a video about that. Link should be somewhere right here. Take care.